Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
It is time for us to support our seniors by updating the Medicare Part D benefit design to give our most vulnerable population the same protections that the rest of us benefit from every day.
Welcome to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. He's Dr. Robert Popovian, joining me from LA, a pharmacist, economist, and chief science policy officer at the Global Healthy Living Foundation.
And up the coast in Seattle, Washington, the gentleman who's waiting by the minute to see when Russell Wilson will come back to playing, he's Connor Mertens, patient advocate and community outreach manager at Global Healthy Living Foundation.
Yeah, and I'll give a begrudging Go Hawks. And as you know, our goal here is to help simplify the complexities in healthcare economics and policy issues for you. But first, we have some listener feedback. Say Shawway writes, breaks through the noise and confusion. Great podcast that breaks down in bite-sized pieces the history of vaccines and the importance of them. That's what we try to do.
That's right, Connor. You know, vaccines are one of the most cost-beneficial interventions in the healthcare system. There's no question of the value they bring to our society. Unfortunately, there are barriers that impede access to vaccines. Today, in this episode, we're going to get into one of those issues, and hopefully you'll understand exactly what we're talking about.
And that review is from Say Shawway. Thanks for your review. We invite all of our listeners to go to Apple Podcasts and leave a very honest 5-star rating and a positive review. And wherever you're listening, don't forget to click that subscribe button so you never miss an episode.
Terrific, Connor. Let's get into this one.
In this week's episode, we're talking about how benefit design in Medicare exacerbates vaccine access inequity. And I guess, Robert, the first question I have is, what is benefit design?
So benefit design is every health insurance policy, whether it's governed through the government, through the private sector, has some type of a design that allows patients to have access to certain hospitals, certain physicians, certain pharmaceuticals at different payment levels. And that's what's considered a benefit design, the design of your benefits that you receive as healthcare from either your employer, through the government, or some other entity.
I think benefit's a loaded word. We know that there's tons of wasteful spending in healthcare, oftentimes to the detriment of patients. In what ways do we see wasteful spending, and how does it impact vaccine care?
So, Connor, it's no secret that there's a lot of waste in healthcare. In fact, we waste approximately $400 billion, if not more, on healthcare waste every year. And that has to do with administrative burden because we are non-compliant with our meds. For a variety of reasons, we waste a lot of money. But one thing we know, and that is undisputable, is the high value that vaccines bring. So basically, any type of a restriction or any type of a policy that reduces the access to vaccination most definitely will negatively impact patients and will increase this wasteful spending that we've been talking about. So vaccines should be regarded as, and are regarded as, the most cost beneficial intervention in healthcare. And unfortunately for Medicare, counterintuitively, the current cost-sharing policies discourage our most vulnerable patient population, our seniors, from accessing these vaccines.
Who is most impacted by these vaccine policies and economics? Is it seniors, the folks that are receiving Medicare Part D benefits?
That's a great question. So the vaccines are divided into two categories for seniors through Medicare. There's the vaccines that are administered through the Part B as in boy program that seniors have great access to, and there's very little out-of-pocket cost involved in it, if any. So patients can show up who are seniors and get their vaccines. For example, flu and pneumococcal vaccine are in those categories. Unfortunately, most of the new vaccines, except for COVID now, that are being developed will be coming out under the Medicare Part D as in dog benefit for seniors. And in that case, there's a co-payment or some type of an out-of-pocket cost associated with that, which is very unusual because if you think about it, the most private insurance plans that are done through the Affordable Care Act provide coverage for vaccines without any out-of-pocket cost for patients. So in effect, by not addressing the out-of-pocket cost issue in Medicare Part D, we're disenfranchising or discouraging the use of these vaccines, which are the most important intervention, by our seniors. That is the problem. What we see is that the population that requires the vaccines the most may be discouraged to use it the most as well.
What's the evidence that this is happening, that folks are inhibited or discouraged from getting the vaccine or the care that they need?
A new study that just came out from IQVIA basically quantified what is going on in Medicare Part D regarding vaccine access and affordability. In the study, IQVIA researched patients or looked at patients who showed up to the pharmacy. The insurance plan had already approved them getting the vaccine. There was no impediment of prior authorization. There was an approval already that took place. And when they were provided choice of paying out of pocket, many of them basically abandoned and refused to take the vaccine in that case. So, for example, the abandonment rate more than doubled if there was a $10 versus $125 out-of-pocket cost for patient. So about 164% increase. And this is because seniors are extremely price sensitive. This is the only area in the healthcare that we currently have, because ACA plans have protections. Most commercial plans allow vaccines to be had without any out-of-pocket costs. The Medicare Part D is the only one that the senior patient that shows up to the pharmacy may have an out-of-pocket cost maybe as little as $10, but it could be the full cost of the vaccine, which could be in the hundreds of dollars. So that's why we need to address this issue.
And it can't just be our seniors. Are other communities impacted by these out-of-pocket costs for vaccines?
Well, interesting you should ask. The research that IQVIA did also looked into what happens to the same senior populations when you start segmenting them between white, Hispanic, or Black. And what they found is that the abandonment rate, if the vaccine was priced between, the out-of-pocket cost was priced between $10 and $40, the white patient's abandonment rate was 28%, compared to 44% for Hispanics and 42% for Black patients. Researchers basically estimated that eliminating out-of-pocket costs would increase fill rates for Hispanic and Black patients to the tune of over 90%. What we need to do is that, because those populations are even more price sensitive, we need to take into consideration what is the impact of this out-of-pocket cost to our minority communities.
And as a result, by removing these out-of-pocket costs, we could see adherence to these vaccines go up as well?
Yes. Eliminating them in the study showed that it would improve vaccine uptake in those specific populations by over 90%. So without a doubt, removing out-of-pocket costs for vaccines will improve adherence. But important to note here, this is not for patients who showed up to the pharmacy and abandoned their vaccines because the insurance company had refused payment for it. This is actually, the insurance company had already approved them being administered the vaccine, but there was some out-of-pocket costs associated with it. That's why it's so important to eliminate the out-of-pocket costs for the vaccines in Part D, period, because any type of an out-of-pocket cost, there's some sensitivity where the patients will not take their vaccines.
And not only that, this will increase better positive health outcomes by eliminating these.
Without a doubt. Vaccines are regarded, as I said, one of the most cost beneficial interventions in the healthcare system. And the best way to provide reduce burden of illness in certain disease areas is through vaccination. And that's why it is so important for us to improve the access to vaccines for our seniors.
Well, around here, we like to get our legislation on. So is anything being done legislatively about this?
Yes. In fact, there is something on the federal level. HR 1978, which is called the Protecting Seniors Through Immunization Act, is being debated right now in Congress. And this act will remove out-of-pocket costs for Part D vaccines for seniors. And there's been also analysis done on that legislation, and it shows that, yes, costs will go up, obviously, because the government will have to absorb some of the cost of out-of-pocket costs, but it's minuscule compared to what it will happen if the patients stop taking their vaccines. Please, as patients, write to your congressman or support HR 1978, which is Protecting Seniors Through Immunization Act.
Well, Robert, it sounds like right now some of the most vulnerable are some of the most disadvantaged at this point, and when it comes to vaccine access and adherence. And a really powerful way to combat that is by eliminating these out-of-pocket costs, especially for Medicare Part D. I'm curious, and as always, we want to hear and give you the last word. What do you think folks should take away from this discussion?
Connor, vaccines provide a fiscally responsible and clinically proven path towards for all of us to survive the current and future epidemics until new therapies are discovered. They may even become the preferred treatment option for chronic diseases like Alzheimer's or Parkinson's. Potential for abuse is non-existent because you're not going to get the vaccine unless you need it, right? It's not something that people are going to abuse. In fact, the primary problem with vaccination is underutilization, which is being caused by some of these policy or benefit design issues like we've discussed on Medicare Part D. It is time for us to support our seniors by updating the Medicare Part D benefit design to give our most vulnerable population the same protections that the rest of us benefit from every day. We hope that you learned something too from this episode. We love to hear from you about how all of us can change policy and support policies that will improve access to vaccines for our most vulnerable patients, our seniors, our treasured seniors. So please send your emails to healthcarematters@ghlf.org. Better yet, including a short video or an audio clip.
And who knows, whatever you share may be included in our listener feedback portion in future episodes. Thanks for listening to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. If you like this episode, please go to Apple Podcasts and leave an honest 5-star rating and a positive review. And wherever you're listening, don't forget to click the subscribe button so you never miss an episode. He's Dr. Robert Popovian.
And he's Connor Mertens. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.